My name is Dr. Raj Selvarajan. I am a specialist general practitioner. I have a practice in north side of Brisbane. I do vasectomy in other parts of Queensland as well. And it's been a pleasure to work with the HealthCert and conducting the advanced workshop for non-scalpel vasectomy over the last 6 to 7 years. And we are looking forward to meeting you to help with your journey in understanding how the vasectomy service can benefit your clinic. Today, we're going to cover some important materials that are covered during the vasectomy consultation and what kind of concerns patients might have and what kind of questions they might pose, as well as things to make the patient aware of, including the risk and complications and the benefits of the procedure, as well as many follow-up instructions as well. As GPs and other experienced doctors, before going into surgical procedure like a vasectomy, you would have a lot of experience as a clinician consulting with the patient's concerns. Vasectomy consultation is no different to any other GP consultation in terms of how the patient is going to ask questions, in terms of the kind of concerns they have. So the main things that when a patient comes and consults me for a vasectomy are to first of all explore the reasons for why they have come for a vasectomy. And most of the times patients have already had this discussion with their family, partner, and other people, including friends and sometimes their GP, and they have made up mind to come for a procedure. However, it's very important that every patient is taken individual scenarios and individual case-by-case basis, and it's important to cover all aspects of what is necessary to cover in a vasectomy consultation. So apart from, first of all, confirming whether they have come for a vasectomy, confirming the identity of the patient, including the age, date of birth, and so forth. Sometimes, when you're running a busy clinic, it can be difficult to ensure that you have the right patient with you. And especially if you're doing a lot of other things as well on the same day, it's very important that the patient has come for a vasectomy consultation, not for a skin check or something else. So what do they ask for? The first question will say, so have you thought about this procedure? Have you considered this is a permanent procedure? So the reason why they have come for a vasectomy is sometimes they have completed the family, or they don't want to father any more children. But have they considered alternative options? Have they considered options like coil implants, which are long-term alternatives for their partner? And are they comfortable with the thought that a vasectomy procedure will make them sterile and it is irreversible for practical purposes? A lot of patients are a bit surprised sometimes to say, oh, is it not reversible? Because they know that a vasectomy reversal exists. So they are actually thinking that, oh, if I change my mind, I may be able to change the procedure. And it's very important for me as a clinician performing vasectomy to make sure that the patient understands that this is a permanent form of contraception, not a reversible alternative. So it's important for me to take them through why I think it is permanent, even though reversal is existing. Reversal can be done. It's not always easy to do it. It's not always cheap, and it's not always successful. So it's important for me to highlight that point. And if the patient is not willing to accept as an option, then the rest of the consultation is pretty much very simple, because they're not probably going for the procedure any further. So apart from the permanency of the procedure, and asking about how many children have they got, if they have any children. And sometimes, they say, okay, I have had, X amount of children, I'm finished with my family, I don't want to father any more children, I want to go for it. The age of the patient is also important. Sometimes we do have inquiries from young patients. When I say young patients who are less than 30 years of age. And sometimes if you're having even younger patients, less than 25, it becomes really important for making sure that the patient fully understands the concept of vasectomy, as well as they have adequate time to reflect on the information that you share. So the age of the patient is important, number of children we ask, and also the general health, if they have any coexisting comorbidities. Diabetes is a common kind of thing that we may come across, but sometimes patients are also on other medications, so medication history is important. Any allergies, the standard kind of things that you would want to cover as well. I also particularly ask them whether they have any bleeding tendencies, even though they may not be fully aware of it, and in case that they're on any kind of over-the-counter medications like fish oil, which may thin the blood as well. Apart from medications, past history, general health, any particular surgical things that has happened in the genital areas, which may include any hernia operations, hydrocele operations in the past, which may pose a technical challenge during the procedure, and any kind of infections, which may include sexually transmitted infections or any other significant infections. If there is an active infection involved, then we do not proceed on the day. But if the infection is past, then we are aware of it, then we can take precautions as well. Any other questions that are relevant to the patients and the couple, like who is going to look after them after the procedure, including what kind of work they do? That includes any kind of advice that we may have to give them. If they are office-based workers, then they may need to only take a couple of days off if they need to. If they are heavy manual work, they may need to look at taking some light duties for a couple of weeks. In fact, this is what typically happens during a consultation as such. We do have a consent form which we go through in detail as well, making sure that it covers the complications and risks associated with vasectomy, and also about the importance of sample testing after the procedure. Some patients may be concerned about chronic testicular ache, which is one of the complications that patients are aware of. It is very difficult to basically tell them that they may not get it or they may get it. The way I usually tell them is it is rare, and it's something in the range of 3 out of 1,000 in my kind of practice. It's important to give them an idea about, yes, it is rare, but when it does happen, then do come back for follow-up so that we can help manage that problem. So it's something that patients may be concerned about. Apart from that, in terms of risk for prostate cancer or testicular cancer, those are not usually the kind of questions that I come across getting asked, but sometimes patients ask them because they have been in the internet, they have been doing some research. Clear evidence suggests that that is not something that is associated with the increased risk. Vasectomy is not associated with increased risk of prostate cancer or testicular cancers for that matter, or heart attacks or any other problems. And the way I would explain to the patient is vasectomy is more like a kind of a plumbing job of disconnecting the tube so that the sperms cannot join the rest of the fluid that is getting secreted by the prostate gland and the rest of the genitourinary system. So I think this gives kind of a picture of what kind of questions that patients will ask, as well as what kind of areas that we need to cover. Some of the times patients are very concerned about the pain they may experience during the procedure or after the procedure. It's a very common kind of concern, I would say. Nervous about having this procedure. I think it's only natural for them to be nervous about having a vasectomy. And I think they have taken the brave step of coming to the consultation, wanting to have the procedure. And I think it's important for them to understand what kind of pain they can experience during or afterwards. So what I would say is most patients find the procedure not as bad as what they thought they would have. And that's important. And sometimes it's, there is some amount of discomfort when we give the local anesthesia, but that usually settles down quickly. And after that, they can only feel touch sensation. So I try to reinforce the concept of it's not completely painless, because sometimes it's important to make sure that it is realistic what they can expect from a procedure. So the local anesthetic has to be given through a small needle and syringe. Unfortunately, there is no way of giving the local anesthesia by any other means. I think that discomfort will be very transient and it will go. The other part of it is afterward the procedure, what kind of pain is expected. And I would always say that because the local anesthetic takes few hours to get out of the system, they are not going to feel any discomfort for the first few hours time. And sometimes they may not feel any pain for the first couple of days. And that's after that period only inflammation can kick in. And that's when they may discover that they may have some discomfort on one side or the other side of the scrotum. So it's quite not natural for them to take some Panadol and Nurofen for pain relief. And if they need anything stronger, that is not an expected pain score after a procedure. So they really shouldn't be requiring anything stronger than a simple Panadol and a simple anti-inflammatory like Brufen after the procedure if they can take it. So chronic testicular ache is again something that may happen after many months rather than in the first 6 months time. We don't call it chronic unless it's beyond that time period. And it could be intermittent. And what I usually say is Yes, it can happen. Sometimes it can have a relationship with what you do, or sometimes during related to say sexual activity. And what I can say is it doesn't interfere from men from doing what they wanted to do, and it's usually manageable with simple painkillers and usually managed conservatively. And very rarely we have to escalate it to further treatments, including referral to pain clinic. So out of 18 years of me doing this procedure, I have referred one patient for pain management in the pain clinic because that was not something that we could resolve locally. The other questions that they may ask about is whether there is any interference with any sexual activity as such. And what I would say is the testis still performs what it needs to do. The function of the testis is not affected. The circulation of the testis is not going to be affected after the procedure. So the testosterone levels don't change. The sexual activity doesn't, get interfered. But however, there is report that patients do associate after the vasectomy, I cannot do this, I cannot have erection or things, but studies have shown that that's not having a direct relationship with the vasectomy cause and effect. So it's important to reassure that this is more of a purely disconnecting the tube rather than having to do with any function of the testosterone or the function of the testis. So those things are mainly the concerns patients may have. The other thing they might also ask about is there any kind of effect on general health as well? And vasectomy does not have any negative effects on the general health as far as we know. And all the current evidence say that it's one of the commonest procedure that is done on fit young men. So it's quite safe, but at the same time there is risks associated with it, and it is something that they need to take into account when they go for a procedure. So having a honest conversation about the procedure, having a clear understanding about what to expect and what happens during the procedure and how to look after the procedure makes the patient feel comfortable and feel that they are being informed about what they need to know, and it helps the process of informed consent, which is the cornerstone of this procedure. Those patients who cannot give an informed consent cannot have this procedure. The laws are very clear. We cannot perform this procedure on people who do not have capacity to consent. So I think it's important to have a clear understanding that it's the responsibility of the clinician who is performing the procedure to make sure that the patient fully understands the pros and cons of this. Next, a typical day, how the procedure flows in my clinic. Basically, we have days where we do only vasectomy. We do have some days where we do other things and vasectomy on top of it. So whatever we do, I will just run through a typical vasectomy day where we just do vasectomy. And it's very important for me to have the vasectomy hat on because I think the whole clinic flow depends on the efficiency of what we do, what the nurses do, what the reception do. And when patients come for a consultation, we do same day procedures. So most of the times, most of the patients prefer same day procedures after the consultation. But sometimes you may have a clinic where you want to have the consultation on one time and plan the procedure on another different date. That's up to you and how you want to run the service. And I think for us, it helps us to see the patient and do the procedure on the same day because most patients are traveling a bit of distance as well, and they don't want to keep coming back and forth. And there is always a attrition ratio when they have consultations, and a small number of patients will not come for procedures on top of that. So you have less attrition ratio when you're seeing the patient and doing the procedure on the same day. So my consultations are like I consult a couple of patients, do a procedure, consult another patient, do another procedure, and it keeps like that so that the patients who are having the consultation have some time for the anxiolytic medications to work, as well as opportunity for them to take a bit of time before they go for the procedure as such. We have something in the range of anything from 3 patients in an afternoon to sometimes 6 to 8 patients in an afternoon. I would normally not do anything else on a vasectomy procedure day because it tends to basically interrupt with the flow of the service and reduces the speed with which we can deliver the service as well. And I think most of the times the patients appreciate that the clinic is focused on one particular service. I think in terms of how the clinic is designed and things, I think every clinic has got its own pros and cons. What we have here is basically place where there is a waiting room, the consultation room. We take the procedure in an operating room, and the post-operative advice and sample advice, how to do the sample test happens on the same day as well. And most of the patients don't have to contact us back until they basically have the sample test done in 4 months' time. That's how it usually works. I think the procedure room is also important for us to make sure that it's comfortable as well as relaxing. So we have a TV on the wall playing some music that helps them to relax. And I think whatever you can do, small things to make the patient's journey more pleasant, helps to make sure that the patient is happy with the service so that they can recommend your service to others after the procedure. The kind of follow-up as well. When we look at follow-up, we have a phone call after the procedure, a couple of days after the procedure, to just see how they're getting on and if there is any concerns, so that we can address them straight away. And after 16 weeks time, we ask them to do the sample test, and if they haven't done the sample test, then we follow them up as well and request them to send another sample. Once they have had the sample tested and it's clear, we communicate the results to them and say that they can safely abandon contraception, but there is still a chance of 1 in 2,000 chance of failure. We reiterate that information at that point in time as well. So, as GPs and as doctors who are looking at the patient journey, it's very important that all the clinical as well as information that is sent to the patient is clear and it's detailed, and it's obviously have a flow which basically helps the patient to clearly understand what is going to happen to them, what is expected of them after the procedure in terms of how to look after them as well as how to do the sample testing. We will cover all these things in the one-day workshop that we have with HealthCert as well, and we also make sure that that is all addressed during the hands-on training. So this is a kind of a overview of what happens during a patient journey for a vasectomy clinic service. Thank you.